Now, first, this anti-diabetic drugs. So first we study about sulfonylurea. So in case of sulfonylureas, we have glimepiride. So this is showing ride, pride, ide. Ide is showing the peptide group. Ide. Okay, so ide is totally denoting peptide. Now, adverse effects of sulfonylureas is hypoglycemia, most important, hypoglycemia, and caution in patients elderly with impaired hepatic or renal functions. So, in case of patients which are having the any liver disorder or kidney disorder, in that cases we will cautiously use the sulfonylurea. And sulfonylurea causes weight gain and fetal hypoglycemia, and crosses the placental barrier. By this mechanism, they are causing fetal hypoglycemia. They sulfonylureas cross the placental barrier, and they are contraindicated in cases of pregnancy. That's why we don't use it. So in case of pregnancy, we generally use insulin. Now the next class of drug is maglitinides. So maglitinides also aids, showing the peptide group, rapaglinide and nateglinide. Quick and short acting insulin secretagogues. They secretes the insulin. Okay, so to control the postprandial hyperglycemia taken shortly before a meal. Before food, we will take this rapaglinide and nateglinide, because they are short acting insulin. They for short time of interval they secrete the insulin, and they control postprandial. After the food, increase in blood sugar will happen, so they will control it, and so we take it before the meal. Okay, some drugs in the diabetes are taken after and some are before. So maglitinide is a drug which is taken before because it is short acting and it secretes the insulin, and it will decrease, control postprandial hyperglycemia. After food intake, it will control, uh, after intake of food, blood sugar will be controlled by the use of maglitinide. Less weight gain is happening with the maglitinide. Less allergic than the sulfonylureas. In sulfonyl, it is better than sulfonylureas because it's having less allergenic property, and even it is causing the less weight gain also. But we have seen in case of sulfonylurea they are causing the weight gain, but these maglitinide are not causing weight gain. Now next class of drug is biguanides. In case of biguanide, we have metformin, and one more we have, that is fenformin. And but fenformin is not being included because of some side effects. Adverse effects of biguanide metformin causing nausea, and it is having some metallic tests. Anorexia is no, not want to have food, means there is a decrease in appetite, uh, and flatulence and diarrhea. Decrease the absorption of vitamin B12, so it may result in megaloblastic anemia. Lactic acidosis is rare in case of metformin. Excreted unchanged in the urine. In urine, it will be excreted unchanged, and metformin. So avoided in patient with the renal insufficiency. So a patient which are having any kind of renal disease or some problems, in that patient we will avoid the metformin use. So whenever we are giving the metformin in patient of diabetes, so we will check about whether the patient are having any kidney disease or not. We will ask about it. If they are having, so we will avoid the metformin. Next, what metformin is doing, increasing the uptake of glucose by the skeletal muscles and reducing the insulin resistance. So whenever there is a muscle, so it is increasing the uptake of uptake of glucose by skeletal muscles. So more glucose will be taken by muscles, so decrease in the blood glucose, and less blood glucose, that will result in less requirement of insulin also, so less insulin resistance will happen. Like this metformin is working. So, and next is in decreasing the hepatic and renal gluconeogenesis. It is decreasing the new glucose formation also from here liver level and kidney level. So it is decreasing the hepatic glucose output. So like this decreased blood glucose level maintained by the use of metformin, and decreasing the glucose absorption from the GIT. So whatever food you have taken by the meal, it is decreasing the absorption of glucose. It might absorb the complex carbohydrates, but it will not absorb the direct glucose absorption. So somehow it is regulating the increasing blood glucose level. So increased blood glucose conversion to lactate by enterocyte um, will happen. Okay, so enterocyte, that is the cells inside the intestinal. Okay, so there is a conversion of that intestinal cells glucose to lactate, and increasing the insulin binding to receptors. Metformin enhancing the insulin binding to their receptor inside the cell. Inside the cell there is insulin receptors also, so it is enhancing by metformin, and decreasing the LDL and VLDL, and increasing the HDL. It is increasing HDL, that is a good cholesterol, by metformin, and decreasing LDL and VLDL, which are the bad cholesterol. So these are the multiple important benefits of metformin. Now, when we study about alpha glucosidase is showing an enzyme. So alpha glucosidase inhibitors, we have acarbose, miglitol, and voglibose. Okay, so glucosidase. Okay, this O and S E. Okay, so this is voglibose, acarbose. What they are doing, they are whatever the complex starches we are not using when we are eating food, we are eating complex carbohydrate, we are not eating the glucose not directly, we are eating roti, or we are eating complex carb like rice with the pulses, and roti with the roti chapatis with vegetables. So these complex starches we are taking, not taking directly glucose. So that complex starches and oligosaccharides or disaccharides is getting converted by alpha glucosidase enzyme to monosaccharides. Okay, so and alpha amylase also is working for the conversion of this complex starch, oligosaccharide, disaccharide into monosaccharide, and this monosaccharide is converting into easily absorbed from the and this is getting absorbed from the small intestine. If we stop this enzyme alpha glucosidase and alpha amylase, so it will not convert into monosaccharide, so more decrease in the monosaccharide, so decrease in the plasma glucose also. So how this we have used this drug alpha glucosidase. So adverse effects of alpha glucosidase is flatulence, diarrhea, abdominal pain. Contraindication is in case of inflammatory bowel disease, we will not use this. And in case of intestinal obstruction also, this is contraindicated because they are working at this enzyme level, and somehow it will cause. Then thiazolidinediones. Thiazolidinediones, we have the drug pioglitazone. Pioglitazone adverse effects is edema and mild anemia, hepatotoxicity which is rare, and carcinoma in bladder. Okay, bladder carcinoma. Okay, and pio is all seeing PO. Okay, with the use of PO, more drink you will do PO, तो bladder, pani PO, bladder. Okay, तो carcinoma of bladder, edema. Whatever the intake of water, it is depositing in the body, so causing swelling. So edema, mild anemia, Avoid in osteoporosis. In case of osteoporosis, we avoid this thiazolidinediones. Thiazolidinediones. This O is indicating this O, and diones O. It is indicating osteoporosis. So it will be avoided in osteoporosis, and contraindicated in case of hepatic failure because it is causing hepatotoxicity. In case of pregnancy, mostly we use insulin, so it is contraindicated here also. In lactation or children cases, it is contraindicated. In case of congestive cardiac failure, also we avoid this pioglitazone because it is causing edema, so it's not good. Now, GLP-1 receptor agonist, exenatide, liraglutide, and abiglutide and dulaglutide.